Okay, let's look at some of the clinical considerations that revolve around adenomyosis. What is it?
It is essentially ectopic endometrial tissue within the myometrium.
That is exactly right. Adenomyosis is defined by the presence of ectopic endometrial glands within the myometrium. And the other aspect of it, of course, is that the presence of this can induce hypertrophic and hyperplastic changes, which will enlarge the uterus.
Okay.
What do you consider an enlarged uterus?
Well,
exactly. Not an easy answer, is it?
If it looks big, I usually think, I don't know that I've ever committed this number to memory, but I feel like over 10 centimeters in length kind of seems a little big to me, but it's almost more of a visual than an...
Okay, well, all of those aspects are true, and people generally have some feeling of what they're going to call an enlarged uterus. In fact, the size of the uterus varies quite a bit. For nulliparous women, it is probably in the range of 9 by 5 by 4. For a multiparous woman, and we often don't know the answer to whether she's nulliparous or multiparous, 11 by 6 by 5. Average length is usually around 8, and I personally do not use the word enlarged until it is greater than 12 centimeters in length, based on some medical legal cases that I've looked at, where the uterus was said to be enlarged, was removed, and the histology said normal.
Interesting.
Okay. So I tend to err on the side of wanting to be certain that if I'm going to use the word enlarged, everyone will agree that somehow or other this is a pathologically enlarged uterus.
Okay. And what about if you had a full bladder? Is that, you take full bladder into account? Because obviously that can tend to squeeze it out and make it...
Actually, no, I don't. But I mean, I'm not saying you're wrong.
Yeah.
It is a consideration. It's just not a consideration I use.
Okay. 12 is too big. Oh, sorry. Is that... yes, I think it is.
Yes, adenomyosis is common, okay? It's a common condition. It predominantly affects women in the late reproductive years, but it's said to occur in about 30% of the general female population, and in hysterectomy specimens, up to 70% of hysterectomy specimens will have some evidence of adenomyosis. You know, and again, it depends on what you're prepared to call adenomyosis.
Right. So are women with adenomyosis usually symptomatic? I would say probably usually they're not.
That is correct. So here we're almost always seeing patients that have symptoms.
Right.
But in fact, most patients with adenomyosis are asymptomatic. And when you look at the types of symptoms that these women have, dysmenorrhea, dyspareunia, chronic pelvic pain, and menometrorrhagia, those four things probably include 95% of the reasons you do pelvic sonograms.
Right.
So it tends to make adenomyosis come up a lot in people's thinking. Right. And it is one of the areas that I consider as a wastebasket diagnosis in diagnostic imaging, where people, they're not afraid to say the word adenomyosis.
Right.
For the radiologists in the audience, they'll say increased markings at the lung bases. Right. Very common phrase, but what does that mean? And the clinician reads that phrase and just throws it in the wastebasket with everything else. Right. And I get a feeling that we're doing that with adenomyosis as well.
Interesting. Okay. Does adenomyosis? I believe it can be on the list of things, yes. Okay,
so that's another interesting question, and another reason why I like to be cautious in using the term adenomyosis. The problem is that many women who have adenomyosis also have endometriosis, and we all know that endometriosis can play a role in infertility. So nonetheless, there are a number of experts who would agree that adenomyosis may contribute at least to infertility. Another reason why I think we want to increase our level of positive predictive value when using the term adenomyosis.
Okay.